So welcome to our final session for the day. I hope you've all had a good day so far. I know that I have. I hope your brains have got room for one more. For many of you, our final speaker needs no introduction. Phil Kerslake is a 7-time lymphoma survivor over a 33-year period, and he's the author of the best-selling, he tells me, internationally published patient support resource, Life, Happiness and Cancer. You will have noticed a complimentary copy of Phil's book in your packs today, and these books have been provided by Roche Products for us free of charge today. So please join with me in thanking Roche for this generous gift. They've also very kindly let us keep the leftovers for our library to continue giving to new patients who come in contact with LBC, which is great. So Phil is a passionate advocate for patients playing an active role in their treatment and recovery, in particular employing psychosocial support measures tactically to help people cope and prevail. So please join with me in welcoming Phil to the stage.
What do you mean he tells you it's internationally published? It is. Hello. Last talk of the day. I don't know if it's good or bad, but I'm very pleased to be here, and I was so thrilled to be invited to the conference. In terms of my approach to the presentation and putting it together, I was going to take a similar approach to Bart Baker, who did our opening plenary talk this morning. But I thought, highly complicated medical data translated in a way which is both humorous and easy to understand by the layperson would just be showing off. So I've decided to take a different approach and do a very simple presentation, albeit that the information that I'm going to provide you is, to my mind, extraordinarily important. Coping with cancer, giving yourself the best chance of prevailing, moving forward, having more birthdays, all those sorts of things. So, resilience. What do people say about resilience? Well, Churchill said that if you're going through hell, keep going. And that's all very well, but how do you do that? How do you do that in the trenches with cancer? Emerson at least felt that we had inside us what was required to be able to keep going forward in that sort of situation. And I love this by Alan Simpson. He's 1,000,000 rubber bands in his resilience. The interesting thing when I read that was, if I'd thought back some years in terms of what metaphorically I would say was representative of resilience, I would have said a brick, because the brick is pretty strong, it's hard to break, and all those sort of things. And as I've sort of gone along, I've recognised that, in fact, a rubber band is exactly what you want to be, so to speak. Not literally, though. Because you need to be flexible, you need to be adaptable, and really these sort of things are the focus of my presentation this afternoon. So, very quickly, an overview of our session. I'm going to talk first of all of my road to wellness. When we talked about how I should present, we decided that I should use myself as a case study in terms of what I've been through, simply because I've been through cancer, lymphoma, Hodgkin disease, etc., through a whole bunch of different cycles of life. And we know that different cycles present different challenges to people affected by cancer. And so because I've been through it in my teens, 20s, 30s, 40s, and now 50, you would never believe it, right? Because that, we thought, well, there might be something useful for each of you, albeit that you're at different places, different ages, and have different blood cancers as well. So I'm going to talk through, kind of briefly, a whole bunch of bullet points about how cancer has tested me. And that's not to just share what I have been through. Really what I'm hoping for there is that as I go through them, you'll be able to identify with at least a bunch of them and understand the challenge that you have been coping with and give yourself a pat on the back with that. And I don't mean to be patronising, but I think what we do is we take a heck of a lot on ourselves when we're coping with cancer, when we're fighting cancer. And very often we don't take stock of what we're actually coping with, which is often phenomenal. So I just want to show you those, and hopefully some of them will resonate with you as well. I'm going to talk about why resilience is so important. I'm going to give you my overarching needs from resilience. Then I'm going to talk about the resilience practices that I've used, and those of you who've read my book and those of you who will read my book None of these will be a surprise to you. There's a couple maybe which aren't in my book, but they won't be a surprise. Then I'm going to talk about the 7 key things that resilience has done for me. So again, in terms of reflecting yourselves into my situation, imagine what you're going through, what you have been through, and imagine what some resilience practices picked up could do for you. And then I'm going to give you some predictable takeaway messages and open to questions and comments. So, my road to wellness, and again, I'm not going to labour this, but that's me when I was actually not diagnosed with cancer. Did I hear someone snigger there? It was the 70s. Early 70s, anyway. That was me as an Auckland Grammar School boy. Now, I hadn't been diagnosed with cancer at that point. I had lumps and bumps under my arms, and my doctor told me that it was glandular fever, the kissing disease. I'm not quite sure how that kind of worked, given that I was at Auckland Grammar, which is an all-boys school. Most of you will know, and you know, I'm straight and all that. But that's what he considered. So years went along, and in 1979, I was a 19-year-old, and I had the bumps were still there, the lumps were still there under my arms, and I had 1 or 2 other minor symptoms, really not enough to send me to the doctor in terms of being worried about the cancer. But they did the job in terms of getting me to a GP who did some tests, who then got me to a specialist, who then got me to the hospital. And after all those sort of tests, etc., a couple of doctors stood in front of me and told me that I had a tumour. And I said, you know, fairly naively, is that a cancer? And they said yes, and I said, well, you know, what does that mean? And they said, well, maybe 10 years. And I said, you mean I might live 10 years less than I otherwise would? And they said, no, you may live up to 10 years. That's the sort of way it is now. So it was considered a low grade. I'm wearing all these different colours, by the way, because I've had lots of different types of lymphoma and Hodgkin disease. So they told me right there, as a 19-year-old, that I had maybe 10 years to live. They weren't going to treat me at that point. They were going to watch me and just see what would happen. Didn't seem like an action plan to me, but anyway, that's what they do sometimes. So, and then I didn't get really sick and need treatments until 1987. Actually, 86 I was very sick, but I hadn't connected that with the lymphoma. 1987, after an overseas trip, I came back and I was in a pretty poor state of affairs. I had lost an awful lot of weight. I had extreme night sweats, you know, a whole bunch of the symptoms that many of you will understand and have experienced yourselves. So I went to my GP. Again, the GP did a bunch of tests, but nothing that I might. He didn't do blood tests. He kind of prodded me, and I had pain in certain areas, so he gave me pain relief, things like that. I mean, the reason I'm pointing this out is because I know that was a long time ago, but you do experience these sorts of things sometimes with your GP, sometimes with other doctors. So you have to be vigilant, and this is part of the thrust of my presentation, is that you need to be vigilant and a proactive patient or a proactive person in the system to give yourself, again, the best chance of moving forward. So, 1987, I started on chemotherapy, and they told me at that stage it was a Hodgkin's disease. I had 6 months chemotherapy, didn't do all the job. I had another 6 months chemotherapy for non-Hodgkin's lymphoma, didn't quite do the job, and then I had radiotherapy across the chest mantle. And so over a period of the end of 1987 to the middle of 1989, I came out of the system in remission. So that was good, you know, and on I went. I jumped ahead just a little bit there because in 2003 I had a lump come up on my neck, and it was I had to wait till over Christmas, you know, to get the results of whether it was localised or whether it was spared and all that sort of stuff. Came back and it was a localised recurrence, and we had treatment for that. We had radiotherapy across here, which is why sometimes I have to have a drink when I'm talking because my saliva glands have dried up, and then we're back into remission. Then I had 10 years of apparent remission, and then when I was self-checking in the shower, as I always do, you know, I'm sort of completely nuts about checking myself and making sure that there's no lump, there's no bump, there's no this, there's no that, and I felt sort of a lump here, back to the GP, back to the hospital, enlarged spleen, further tests, back to stage 4, and back into more treatment. So that was what I thought was the end of my cancer journey, because I really did think, and I'll tell you about the treatments that I had, but I really thought that we'd got it this time. Except I'd started a family, and by the way, my oldest, don't you reckon he's a dead ringer for Bart's son, eldest son? I was looking at that earlier on, I was like, oh, hang on, it may not look like it there, but believe me, he does. And what disturbs me is, I think it was about 6 years ago when he and I did that video in conjunction with my wife. Bart's not here, I don't think. Are you, Bart? To defend yourself. So I'll say no more, but I was a little bit disturbed. But anyway, I was, productively moving along. We'd had 2 sons, we'd started a family, it's all happy, etc. And then in 2009, I had another lump spring up in the groin area, and off I went again, and it wasn't a localised recurrence, it was another recurrence, lumped up and down here, and 1 or 2 other things. And we're in a sort of a waiting pattern, a waiting and holding pattern now. So I've got a chronic disease, it appears, which, I really thought I would get the cure, but I never really did. So through all that, in terms of treatments that I have experienced personally and therefore understand reasonably well, I had 10 general anaesthetic operations, including the removal of my spleen, about 2 years of chemotherapy in total, high-dose chemotherapy and a stem cell transplant. So, bad idea for a hobby is how I often refer to it. But